Surgery has never been a hatchet job, but now it's set to be more precise than ever. Thanks to this brand new surgical robot installed at Stepping Hill Hospital in Stockport. The first of its kind in the Northwest, Da Vinci SI marks the start of a robotic revolution in cancer surgery. Mr. Neil Oakley is the first surgeon to operate the machine, and he knows it like the back of his hand.
With the patient, we make small incisions in the abdomen, approximately a centimetre across. Through those incisions we put a metal port, which is a plastic it's a tube with a little plastic seal on the end. We connect that to each of these arms. The only thing that will move is when I tell it to move with my joystick and my console, which I'll show you in a second. Here there are 4 little grips. These grips attach to the surgical instrument, and as they turn they drive various cogs and wires which cause the tips of the instruments to move inside the patient. So effectively what you have on the inside of the patient is a wrist, like this. The human body is very good at big sweeping manoeuvres. It's not that good at very small, fine motor skills because you get tremor and you get fatigue. What this allows us to do is to take those large movements and to scale them down to be small movements inside the patient. What we're expecting is this robot is going to take us to greater levels of surgical precision. It's going to allow us to perform operations with less trauma to the patient. It's going to allow them to go home earlier, to have less bleeding. And importantly, there's some very, very important functional outcomes that we expect this robot to improve. We would hope that patients who have prostate cancer that are going to have their prostates removed with this robot will have a better chance of retaining their full erections or their full urinary control post-surgery. We're hoping that kidney cancer patients, where traditionally they'd have an operation to remove the entire kidney, usually with keyhole surgery, but sometimes with large incisions, we're expecting those operations to be performed in an even more precise way, in a way that you can remove the cancer but save the kidney. An operation that will effectively allow us such precise control over the blood supply to that kidney, it's able to remove a quarter of it, a third of it, remove just the tumour and save the rest of the kidney.
Da Vinci cost the NHS over £1 million, but it has proven that it's worth every penny of it. Adam Farkas, that's Manchester.